Right. Good evening, everybody. I want to welcome you to the monthly Scarborough Guildwood Town Hall meeting with myself, City Councillor Paul Ainsley, my provincial and federal colleagues, John McKay, MP, and Mitzi Hunter, MPP. And this evening, we're joined by our special guest, Dr. Shovita Patti. Dr. Shovita Patti is currently an Associate Medical Officer of Health and is Toronto Public Health's lead for COVID-19 mass immunization clinics. Previously working as the Medical Officer of Health at the Fraser Health in British Columbia and as a Deputy Medical Officer of Health in Saskatoon Health Region. Dr. Patti holds faculty appointments at the University of British Columbia and the University of Toronto. Dr. Patti received her Doctorate of Medicine from the University of Ottawa and completed her specialty training in public health and preventative medicine at the University of Toronto. Dr. Patti, I'd really like to welcome you here this evening.
Thank you so much, Councillor Ainsley, and thank you all for having me today. It's a pleasure to be here.
Excellent. Thank you. So our usual format tonight, we have asked residents ahead of time for questions and answers, and we also have people texting or emailing in their answers that our staff are going to be feeding us. So I'll start with John. You're up first, John, for questions this time.
Number one in the batting order. Well, that's good. Dr. Patti, first of all, welcome to the center of the universe, which is Scarborough. You probably don't know that, but it's true. And we have some of the most intelligent people here in the entire country, and one of whom is Marcia. And this is something we've been really hearing a lot about. I've been trying to book appointments for my daughter and myself since you sent the email. Oh, no. Me, but I've not been successful. We have been sending out pop-up clinic emails. If we expect the city to be open, why is it so difficult to get an appointment? And especially as I work in high-risk areas as health and safety inspector with the school board. Well, that's pretty serious work. It is extremely frustrating, as it seems that we have to check every minute daily. So what is your answer to Marcia?
First of all, Marcia, I really want to apologize for the experience you're having. I do want to acknowledge it is frustrating, and for everyone out there, I can't fault you. It is a bit confusing because here in Toronto, we actually have many avenues to get your immunizations, and part of our thinking was that we wanted to have different avenues available to everyone, because different people have different lifestyles, different schedules, and we want to make sure getting your immunizations are as easy as possible. But definitely hearing that scheduling is not an ideal situation right now, and I really definitely want to apologize, and we are trying to make things better. So I will say this, probably your easiest shot to get an immunization is actually to go check out our website at toronto.ca/COVID-19. There you'll find the link to the city clinics, which is a booking link, and it directs you to the provincial system, which is the system that the city clinics are employing right now to book your appointment at one of our clinics. And if you're having struggles with the online system, you can also call the provincial call center, which operates, I believe, till 8 p.m. every single day, and I'm sure they'd be able to help you out. That said, what this really boils down to is that we just don't have enough vaccine supply right now. We're talking about the hottest commodity on this planet, in the universe right now, is COVID-19 vaccine. And we're really dependent on the supplies. And at our city clinics, for example, we only schedule appointments according to how much vaccine we know we're going to get. So, I'm sorry you don't have an easy answer for you. Your best bet is to try our website and call the provincial call center for more assistance in booking an appointment, and hopefully we'll get you in soon.
Janet asks a similar question about trying to book an appointment for a friend. And for several days, I've logged on at midnight when the new date rolls over. Appointments can only be booked 14 days in advance. But despite that, there are no appointments available at all. So she's obviously quite familiar with the system. What's the point of saying that the site is open for bookings when the appointments are obviously already booked? Because perhaps it's because of rebooking the 10,000 appointments that were canceled when the site was taken down. I think there she's referring to the Scarborough sites where the hospital, the Scarborough Health Network, had to cancel both the Progress campus and the Centenary campus. But if that's the case, why not tell people so they don't waste your time and energy fruitlessly trying to book an appointment? And there's no more virtual waiting rooms, so obviously people have given up trying to book through the Scarborough Health System. Perhaps you could and should be researched prior to the town hall meeting. Well, you're on the hot seat here. You're in a hot spot because 15 of the 17 postal codes in Scarborough are hot spots. So you're on the hot seat in the hot spot. And you might talk about the interaction between the Scarborough Health Network and the City of Toronto Health System and the interaction with the province, which apparently had 500,000 bookings yesterday. So maybe you could talk to Janet about what she's asking here.
Sure, Janet. And I just once again want to apologize for the frustrating experience you're having. But I'm so glad that you're supporting your friend and just really helping people get their immunizations. So I just want everyone to acknowledge that this is actually a historic undertaking right now. This is the largest immunization campaign we've actually ever undertaken in the history of humanity, and at this pace. And not making excuses, but there's going to be bumps in the road here. And in order to take this, have this massive undertaking, we have to have as many hands on deck. And so what that means is that we're working together as Toronto Public Health, the City of Toronto, working with our numerous healthcare partners. So whether it's Scarborough Health Network, our other hospital partners, our Ontario Health teams, as well as our pharmacies. And so everyone is pitching in this huge effort. And once again, I really want to apologize that we heard Scarborough Health Network had to cancel appointments because of vaccine supply. That's really kind of a rate limiting step right now, unfortunately. And, we hope with time, especially as Moderna retools their plant and they can actually manufacture more vaccine, this problem will be alleviated. So, once again, I can't speak for the Scarborough Health Network clinics, but I'm speaking to the City of Toronto clinics. We only create appointments if we are 100% sure we have the vaccine. So it would be in a really rare circumstance we would have to cancel clinics. But what happens then is that we always have, we don't have that many appointments to offer because it's all based on vaccine supply. Sorry to bring it back to that. So what I suggest is, once again, go to toronto.ca/COVID-19, check out our website and try the online booking system for your friend, or try the provincial call center, and hopefully we can find you an appointment soon.
Perfect. Excellent. Thank you. Mitzi.
Thank you. Thanks, Councillor Ainsley, and good evening, everyone. It's unbelievable, actually, that we're still meeting in this format month over month. It's been pretty much about a year that we've been meeting each month like this. So, Dr. Patty, we are very happy to have you tonight. And I do want to say to everyone that, I'm wearing red tonight. It is the National Day of Awareness for Missing and Murdered Indigenous Women and Girls. And we cannot forget those who have been affected by violence and their families. So just want to remember them tonight. So, Dr. Patty, we have, as you know, a very active constituency here in Scarborough Guildwood. It is one of the hottest of the hotspots. And so, one of the questions that we're being asked, as many of our constituents are essential workers and they've continued to work throughout the pandemic. So David is asking, he crosses the border for his job, and he is an essential worker, one of the many in Scarborough, Guildwood. But when he goes to the clinic and answers the question about being out of the country, he says that he is turned away from the vaccination clinic. So I guess he is trying to get his vaccine as an essential worker who travels frequently. So he basically says, how do I get vaccinated?
Yeah, so first of all, David, thank you for your service. Essential workers are really key to keeping our country running. It's why we still have food on our table. So really, thank you for your service. And I do want to stress that, when you go to any clinic, they have these screening questions. And of course, if you've been out of the country, you should technically be quarantining. But we know there are exceptions for, and exemptions, I should say, federal exemptions for individuals who do cross the border because they are essential workers. And I can only speak for our mass immunization clinics at the city, but we do recognize these groups of individuals. And what I suggest is, if possible, if you can bring a letter from your employer stating that you are an essential worker and you have to cross the border frequently for your job. I have actually informed our team that provided you don't have any symptoms, you should be permitted to get your vaccine at our clinics. So that's probably the best solution. So for anyone out there who is an essential worker, I know, for example, we've had flight attendants come to our clinic. They brought a letter stating that I'm a flight attendant. I have to travel because of my job. As long as they don't have symptoms and they haven't been in contact with a recent COVID case, you are most definitely permitted to come into the clinic and get immunized.
It's really great, Dr. Patty, that Toronto Public Health provides that service to our much needed essential workers. So Jack is asking a question here. Jack was one of the first in line to get his AstraZeneca shot when it opened up at Shoppers Drug Mart. And at the time, they were unable to tell him or give him a date for a second shot. So he has no clue about when he can have his second shot. So what do we say to Jack?
So Jack, congratulations on getting your vaccine, and I'm glad you were so keen and you got your AstraZeneca. That's amazing. It's a great vaccine. I'll say this. I know there's going to be a lot of you in this situation because, once again, it's going back to that, vaccine supply issue that we have. And right now, at least I haven't heard anything recently on what the sightlines are for AstraZeneca coming to the country, right? We know there's sort of two major locations in the world that produce AstraZeneca, one in Europe and then, of course, in India. And we know there's a humanitarian crisis essentially going on in India right now with COVID, and really getting supply from there is the chances are probably limited. So firstly, I'll just state, we don't know when we're getting more AstraZeneca. That said, we know there are so many people who are in this situation, and NACI, the National Advisory Committee on Immunizations, who you've heard, they're reviewing the studies right now to see what we call is vaccine interchangeability. So right now, we generally don't advise people to get different vaccine products or different types of vaccines. We have the mRNA vaccines, which are the Pfizer and the Moderna, and we have the adenovirus vector vaccines, which are the AstraZeneca and the Johnson & Johnson. And right now, we're not, we don't recommend mixing the two, but we recognize that people will be in this position where they got the AstraZeneca, but if we don't get any, we want to make sure that you're still protected. So I would say, there's still time between your first dose and your second dose. And between that, we do expect to hear from our counterparts at NACI on whether you'll be eligible for another vaccine such as Pfizer or Moderna. So, you'll have to still stay tuned. And what I also suggest is when it gets closer to the date of your second dose, so the 116 days have passed from your first dose of AstraZeneca, is to contact the Shoppers Drug Mart and see if they have any more details on second doses as well.
Thanks, Mitzi. Dr. Patty, I have Jane, who says she has an 18-year-old daughter and has an upcoming appointment booked to get her vaccination, would it be possible for my daughter to get her shot with me when she comes with me?
So, as much as I want to make this as easy for everyone, unfortunately, our clinic appointments get booked up really quickly, and we do need to honor everyone who has booked an appointment. So right now, we can't take walk-ins into our clinics. Maybe into the future, when we get more vaccine supply, that'll be possible. But my apologies. But if Jane, if your daughter and you is 18 and lives obviously in the hotspot zone with you. You can try to book into our mass immunization clinic. So right now we are taking bookings for anyone who's 18 and over living in a hotspot in Toronto. You can book into our mass immunization clinics.
Okay. Thanks, Dr. Patty. The next question is from Chris and Nisa, who say, I have received the first dose of the vaccine, but I know there are others that believe that once they've received their first dose, they're immune to COVID-19. Can you clarify on the rules after you receive your first dose?
All right, Chris and Nessa, I love this question. Thank you for raising this because for me, the vaccines are amazing, but we know they're not 100% protective, right? And we still have to wait for much more of the population to still get immunized, right? You've heard the recent news reports. Approximately 40% of Torontonians have received their first dose, right? And for most of these vaccines, you need to receive 2 doses to be really protected, right? Especially with the Pfizer and Moderna, to hit that 90 to 95%, you need to have your 2 doses. And so that said, let me just stress this first and apologize if this gets a little nerdy and I am a doctor and I'm a scientist, so I love immunology, but first and foremost, I want to convey that as soon as you get your shot, it doesn't mean you have this invisibility cloak to COVID. It doesn't mean you're magically instantaneously protected. It actually takes several weeks to develop antibodies to protect yourself. So to keep that in mind, okay? So with that in mind, we still have to adhere to all of those public health measures, okay? So that means maintaining your distance, not going to crowded spaces and gatherings, wearing your mask at all times, including outdoors if you can't safely distance with someone, washing your hands, and of course, if you are symptomatic, to stay at home. And what I do want to stress too is, yes, you can become sick after you've received your vaccine because you just may not have had enough time to develop antibodies. So if you do develop symptoms after you've been immunized, you still need to follow all the same rules again, right? Stay at home, isolate, and get yourself tested as soon as possible because you could still have COVID. So really thankful for this question and really want to stress, I know everyone is tired and fatigued and, their hands are all dry from washing their hands so much with the alcohol, this hand sanitizer, and we all want to have parties and barbecues, but, we just need to keep at it a little bit longer. And then the better we stick to these public health measures, the sooner this will end. So, keep at it. So just stating that, get your vaccine, but we got to still keep at the public health measures.
And Dr. Patty, if you had somebody, like say 2 individuals working in an office, they were the only ones in an office, they both had their shots, but they should still both wear their masks, maintain their social distancing, and not interact with others. That'd be similar?
Yes. Same thing. And I would also advise if you are someone who does have to physically go into work, you should always screen yourself every day, every morning before your shift, before you go to work. Make sure you don't have any kind of symptoms. If you have any kind of symptoms, please stay at home and get yourself tested as soon as possible.
Perfect. Excellent. John, your turn.
Yeah, further to Dr. Brady's point, I do have a friend who did get his shot and 2 or 3 days later got COVID. And fortunately, it came through. I think, further to your point, I take it the further along you are between your shot and your symptoms, the better off you are. The vaccine starts to, if you will, reduce the symptoms, but it doesn't actually prevent the disease. So you build it up after 2 or 3 years. Anyway, let's get to Cheryl here. who is some irritated, may I say. So the Scarborough vaccine clinics, Centenary and Centennial, are already fully booked for May 1 through 14. They didn't bother rebooking people who had appointments canceled in April. I booked an appointment at Scarborough Town Centre through the provincial site for May 14th, but I'm not sure that it won't be canceled. The pop-up clinics are nice, but not everyone can get up at 5 a.m. for a pop-up appointment. Being a pharmacy appointment seems to require the ability to just drop everything. I work from home, but I do work all day. At every level and every political stripe, politicians should be deeply ashamed. So, other than being deeply ashamed, what would you say to Cheryl?
Cheryl, I'm really sorry about your frustrating experience, and I'm sorry your appointment was canceled. I can't speak for Scarborough Health Network clinics, which are the Centenary and Centennial clinics. I can only speak for the city clinics, which are under my sort of responsibility. Once again, to reiterate, the City of Toronto. So I'm glad you were able to get an appointment. So I don't anticipate that your appointment will be canceled. We do have the vaccine for that appointment. And, once again, I hope into the future things will get better as vaccine supply improves.
Yeah, she's not convinced that her appointment that she has won't be canceled, but I guess we'll see. Just
have
on
a little
that.
faith, yeah.
Moving into the country. I think that's the correct number. And I think the agreement among the provinces is that it's per capita. So that would mean for the province of Ontario, roughly 40% of that 2 million, which is in the order of 800,000 available in the province. So of that 800,000, how many doses would Toronto get?
All right. For the record, math is not my forte at this hour of
You're
the
a
day.
scientist and a doctor. You should say us. We went to law school. We know that math is not our strength. Yeah.
So I'll state this. The province when the doses are allocated from the federal government to the provincial governments, the province is responsible for the allocation, and they do this. They look at the data, they reassess things on a regular basis, and so usually it's about 20% of the provincial allocation will come to the overall City of Toronto. And as you've probably heard through the media, that additional doses were given to municipalities who had really hotspot areas. So that included the City of Toronto, I believe, Peel, possibly York Region, and also received additional doses from their sort of per capita. And when those doses then come from the province, we then have to divvy it up amongst all of the service providers that we have within the City of Toronto. So I'm just trying to say this in the spirit of transparency. And this is done looking at, where is the greatest need? So looking at especially the hottest of the hotspot neighborhoods. And how much each service provider can actually administer based on their human resource capacity, and looking at sort of vaccine cold spots as well, right? Where is there really low coverage? And then also factoring in data such as where are the people coming from who are ending up in hospital or who are unfortunately passing away, right? So there is a lot of science and math that happens more so in the daytime hours, although a lot at night as well. But that's how we divvy up the doses. So I can speak for the City of Toronto. This week is what we call a feast week. We actually got a lot of doses. We have 80,000 doses on hand. And I can say our clinics are booked at 100% right now.
So if you've got 80,000 for the Toronto Health Network, now you would think if the city or if the province received 800,000, the city should receive somewhere between 150 and 200,000. So
yes, correct.
So how is it you only got 80?
Oh, so sorry, this is just to the City of Toronto mass immunization clinics.
Oh, okay.
So-
Not including the hospitals.
Not including the hospital.
Hospitals.
Okay.
And then we also have this really amazing, what we call a mobile sprint strategy. So those are also our hospital and our Ontario Health Team partners who are setting up the pop-up clinics and other small clinics in the really hotspot neighborhoods, making sure that people in those communities have direct access to the vaccine.
Yeah. So, I don't want to divert from the constituents' questions here, but it is germane. So this week, between the City of Toronto and the various health networks and the various others that are associated, what is being distributed? Is 200,000 doses? Is it 250?
I don't have the exact number off the top of my head, but it is. Let me just think right now. It's between 250 to 300,000 doses.
So that's a serious number. That's a serious number, and people should take some comfort out of that. Okay, yeah. Thank you for that. So Massey, hang on, and that's Massey.
You got another one, John?
Well, that was my question, not Massey's question. So I'm 45 years old, and I'm looking for a Pfizer or Moderna. Are these available in Scarborough? Answer is yes.
Yeah, you know it. Yes.
Yeah,
and yeah. We have those vaccines. I'll say Pfizer is more plentiful because that's our more stable supply. Moderna comes in fits and bursts because they're still retooling their plant in Europe. But yeah, and both are great.
You have no opinion which one she should take. First one.
First one. You know it.
First come, first serve.
Exactly.
Yeah, I've heard this. Yeah. Okay. Good. Thank you.
Mitzi?
So, Dr. Patty, I'm wondering for Mark about, I know July 2nd dose, but she wants to know if the supply will be enough in July for a second dose of her AstraZeneca shot.
Yeah, I'm sorry.
Just to double down on that.
Yeah.
For you.
Yeah, once again, just to reiterate, the federal government is responsible for what we call vaccine procurement and acquiring the vaccine and bringing it to Canada. So unfortunately, I don't have any more details or sightlines on that. But, I just want to I can put people's minds at ease. If you got AstraZeneca and the supplies is questionable, NACI is looking into seeing, whether we can give you a Pfizer or Moderna for your second dose.
Right. And the federal government is also responsible for the weather. So all of the clouds and rain this week is over to you, John.
Thank you. Thanks very much. Yeah. If you believe Doug Ford, that's probably true. Yeah.
Dr. Patty, I do have another question here, and it's just once an individual starts receiving, once we start giving second doses to everyone, which is my understanding is going to perhaps even be accelerated with the voluminous supply that we now have of vaccines. How do people who have not yet received their vaccine get prioritized? And I would see this as, in the minds of Toronto Public Health. So for our local community in Scarborough.
Most definitely. So, there's a few angles here I want to sort of answer this question. So the overall prioritization framework of who got to go first in line for a vaccine was developed by our provincial counterparts at the vaccine task force, and a lot of science and ethics and things like that went into who was prioritized. That said, we know there are people who are going to be due for their second doses, while there's still a large segment of the population who have not received their first dose. And we are looking into this strategy right now. So there's active work ongoing onto what we call the second dose strategy, because we want to make sure no one is left behind. And ideally, the reason we went to an extended interval between dose 1 and dose 2 is because we wanted to get as many people immunized as possible. So there is active work going on, and it is also contingent on supply. So once again, going back to the math, we're going to have to do some really hard math to see how many people are left who are unimmunized, and how do we, make slots for them in our clinics and bring them in, while we still respect the second dose interval for the remaining people. The other thing I want to say is, we know it's not easy. I want to acknowledge that first and foremost. And I've done a lot of research in my past around this on other vaccines. It's not easy for everyone to just come to a clinic. Some people are working 3 jobs. Some people have, people to take care of at home, and they can't just leave their home to get vaccinated. And so this is why we're working with all of our health sector partners, as well as different community agencies, to see how we can make vaccine as accessible as possible. And as we start getting more of the fridge stable vaccines, so as if we get more AstraZeneca, more Johnson & Johnson, which is fridge stable, and even Moderna to a certain extent, which is fridge stable, we can have more access points for people to access vaccine as well. So we want to make sure that everyone has as many opportunities as possible to get immunized. We don't want anyone left behind. And so that is definitely at the forefront of public health's mind, because in order for us to get out of this pandemic, we need to have at least, for me, I would say probably 80 to 85% of our community, fully vaccinated, right? So work is going on behind the scenes around that piece.
I just have a tack on, because this is late breaking today. Health Canada approved Pfizer, the mRNA vaccine for those adolescents, 12 to 16 years old. And I know that the province is sort of still deliberating on how that rollout is going to happen, whether through schools but the expectation is that it will happen before school resumes in September. And so that's also adding to the mix of prioritization, because now there's eligibility from, a scientific perspective for one of the vaccines to be administered to those adolescents.
Yeah, most definitely. And I know at the province, the Ministry of Health is convening what they call a pediatric table. And so they're actually discussing that very topic right now. And I should say they've been actually discussing that for a few weeks now. So even prior to this Health Canada approval for 12 and above for Pfizer. So we'll continue to monitor the situation. And I just want to state too, so there's really important in the pediatric population. This pandemic has actually derailed our other routine immunization programs that we would offer in schools, right? Our HPV vaccines, our hepatitis B's. So as children who are immunized for all the other diseases as well. And so there has to be some thought also to that. It's how do we not only get these children immunized for COVID-19, but also catch them up on their other vaccines.
Good point.
Yeah. And that leads into my next question, Dr. Kathy asks, I can't get a vaccine. I'm 67 years old with limited mobility. Nobody to help. Rumors on mobile may be coming to my building. I'm also on the registration list for shoppers as well as Rexall, and I can't decide what to do.
So, Kathy, really sorry to hear about your mobility issues and your health conditions, but I'm really glad you're trying really hard to get immunized. I think, yes, that's great that you put yourself on a list for the pharmacies. And I just want to share, there is some hope, even though the AstraZeneca may not be coming. There has been a Pfizer pilot at a few pharmacies, and it's actually gone extremely well, and they've used up their doses. So, continue to touch base with your pharmacy to see if they'll eventually get, say, Pfizer or Moderna. The other thing, too, is maybe you want to contact your primary practitioner, so whether you're a family doctor or if you have a nurse practitioner, and ask them if they have any insight on either family practices who might still have some AstraZeneca doses on hand, or if they can connect you with and I'm still learning the system here, so I apologize, whether it's through the LIN or through the Ontario Health teams, whether they can, identify you as someone who's homebound and could qualify for that program, to have someone deliver an immunization at your door, and also or has insight into a mobile clinic. So I will say this: there are several buildings who have been identified. They either have many elderly people living there or people with medical conditions. They are on a list, and I know the Ontario Health teams are slowly getting to them based on vaccine supply. So that rumor could be very well true. I just don't have timelines on when a mobile clinic might be coming to your building.
And when she talks about rumors of a mobile clinic, my understanding is the briefings that we've been getting from City Hall is mobile clinics are very targeted to a building or a clump of buildings. They wouldn't advertise to an entire postal code per se.
No, it would be very targeted, and they'd probably work with either a service provider who already serves that building or that building manager.
Okay. And my next question is, and that's around buildings as well. What is the strategy to vaccinate residents in Toronto community housing buildings, as all the buildings in Scarborough are considered in hotspot postal codes?
So my understanding is that these buildings have been identified, and basically all of these buildings are sort of put on a list by Ontario Health, and a risk stratification is done based on what we know about those buildings and who lives in those buildings, right? If it's a higher proportion of seniors who live in that building, or special populations who may have other medical conditions. So that's stratified, and basically Ontario Health has this list, and they're slowly going through those buildings, building by building, based on vaccine supply and their own capacity to immunize. So it's just a matter of time. But I should say this: if you do live in a hotspot and you do have the ability to either go to a pop-up clinic or to register for a mass immunization clinic, don't hesitate to wait, because we don't know how long it'll take to get an actual mobile clinic there.
Perfect. Thank you. Mr. McKay, you're up.
I think just on that point, wasn't there a pop-up clinic at Scarborough Village today? I think it was today. I understood it's very popular. So, Dr. Brady, we got Chris here, who's worried about missing his second appointment. What happens to him if by accident or otherwise he misses his second appointment?
So if you book through the provincial booking system, you will actually get reminders, because we know 112 or 116 days is still a ways off, and so you will get a few reminders about your appointment. So we do try to avoid missed appointments. But you know what? Life happens, and sometimes you will miss your appointment, and that's okay. So if that happens, call the provincial call center, and we'll get you rebooked for a second dose.
Okay.
I think I'm up.
Mm-hmm.
So, actually, I have a question.
And I was muted. Mitzi.
That's okay. I got your back, Paul. So one of our very active residents is Nessa, and I know, like, I have answered.
We all know Nessa. We all know Nessa.
And Nessa works so collaboratively, with the people in her community, and she's wondering if all seniors will have their second dose by June. So remember when we had started with sort of those over 80, and then we went to 75 and over. So will the elderly be fully vaccinated by end of June in your estimation?
I have a keen interest in this question.
Some personal investment.
Indeed.
So I'll say, actually, not necessarily. of course, if there is more vaccine supply and there's a change in provincial guidance, we'll definitely move people up. But we still have many people who are on that 116 day interval. And because, for instance, our mass clinic started, first day was March 17th. So actually, the first day of second doses won't start until about July 7th, that week there. So, to answer Nessa's questions, no, not all seniors will have their second dose by June. But I should say this, though, if people who are residing in long-term care facilities and retirement homes, we are respecting the product, what we call the product monograph dose interval, so the 21 or the 28 days based on the product. So because those individuals are at higher risk of succumbing to severe illness and hospitalization and unfortunately death, they will receive their second dose within that time frame.
Okay. Again, from Karen, she's a designated caregiver and a volunteer in a seniors residence. She received Pfizer in March, and this was administered through Michael Garron Hospital. She wants to know how she will be notified.
So unfortunately, can't have a hospital, but I would suggest connect them. It's instructions on how to book the second dose.
Okay. And Dr. Patty, all of Scarborough's postal codes are considered hotspots. Why have pop-ups only happened in 3 of the hotspot postal codes to date?
All right. That's a great question. This is something we actually get asked a lot. I'll say this. We actually have 2 phenomenal leaders. One is from Michael Garron Hospital and one is from University Health Network, who are leading what we call our mobile sprint strategy. And as you may have heard, that City of Toronto actually has 53 postal codes that have been identified as hotspots. But of those 53, we identified, or I should say these 2 individuals who are leading the mobile sprint strategy identified 13 really, really hot spots. Hotspots in terms of high number of COVID cases and people ending up in hospital and unfortunately dying as well. And what I'd like to call a cold spot for vaccine. And so there was a lot of data and math and science that went into where the initial pop-up clinic should go, because there was an actual urgent need for vaccine in these so-called cold spots, because they literally had not even barely single digit immunization coverage rates. And so the population was quite at risk. And so I think they started about 2 weeks ago. So they've had some huge success, and they've actually increased the coverage rates dramatically in those hotspot neighborhoods. They're actually now adding more postal code neighborhoods, and I believe there were 4 more postal codes added to this strategy. So there should be more pop-up clinics coming to the Scarborough locations both this week and as well as next week.
Okay. And related question, what is the current per day capacity at the city's immunization clinics? And are there any plans to increase it or open more clinics, as we're expected to get a steady supply of vaccines starting this week?
Yes. So actually, our clinics, and I would say our health sector partner clinics, actually I shouldn't speak for them, I'll speak for the City of Toronto clinics. We actually have a fair bit of capacity. We could actually do upwards of 90,000 doses per week. And as I mentioned earlier, this week we're doing upwards of 80,000. So what our rate limiting step right now or factor is really that vaccine supply. And of course, we could even expand further by increasing our hours. So if we ever get into that, flood of vaccine situation, we are ready to inject, arms. That's not the issue. So it's really the supply that's hampering us right now. But hopefully with time it'll get better. So I hope that answered that question.
So if you added in the health networks, would you double the 90,000?
So MP McKay, you're asking me math again at this hour. Let me just do some math in my head. I would have to confirm what the overall city capacity is, but it's definitely well over 100,000. Total health sector capacity. And of course, it's changing as we figure out more efficient ways to structure our clinics. So there's definitely a lot of what we call that could happen if we had the vaccine. And I'll tell you this, so this is the largest supply we've ever received so far to date this week. And we have no problem burning through those doses. I think we're burning anywhere from 30 to 40,000 doses a day. And we're not even breaking a sweat, basically. So we can definitely handle the volume. We just need the supply.
Sorry, Paul. When you say you're burning through 30 or 40 a day, that's just the city of Toronto.
That's just the city of Toronto.
And you've got a capacity to do 90. So really, if you work three days, you'd be out of your supply.
Well, 90,000 is just for the City of Toronto mass immunization clinics, but overall City of Toronto approach with our health sector partners, 90,000 we could burn through easily in 3 days, even faster depending how stacked our clinics were. So,
Thank you.
Okay. We're at 7:45. Dr. Patty, we're going to play rapid fire with you now. We always get lots of questions. Mitzi?
So another question from Nessa, and she wants to know what the restrictions are. And I think it's a really good reminder, Dr. Patty, once someone has their first vaccine, what are those restrictions?
So it's still the same restrictions, that you had to go through 5 minutes before you got your vaccine, right? So I'll reiterate it again, because this is really important. It takes several weeks for your body to actually develop antibodies to protect you from COVID. And even though you're protected, a lot of the public still isn't protected because we still need to get a lot of needles into arms. So what that means, you still have to keep your distance, wear your mask, wash your hands, not go into gatherings, stick to your household members. And if you're sick or symptomatic, which could happen if you've been immunized, you need to stay at home, isolate, and get yourself tested as soon as possible.
That's great. And John, go ahead, John.
Well, I thought these were all Mitzi's questions, but because the two of them are provincial and Mitzi's the queen of the provincial knowledge, so I'm going to defer to Mitzi.
I'll keep going. And they are provincial questions. So Dr. Patty, I can jump in as well. So Sierra is asking, I need to take time off work to get vaccinated. Can I use the provincial paid sick days to get vaccinated or tested?
So actually, I can't speak to the latest paid sick day. So I might hand that back over to you.
Okay. So,
sorry.
Well done.
Okay. So, yes. So the 3 provincial paid sick days, which will be administered through the employer, who will then claim back up to $200 a day from WSIB. So those paid sick days are flexible. They can be used to go and get a COVID test, to get your vaccination. And if you need to stay at home, if you're sick or symptomatic, as you said earlier, you check yourself and you feel that you have symptoms, it's better to be cautious and to stay home or get tested to be sure. And that's exactly what those paid sick days are for. Of course, we know that the federal government also has a program of up to 20 days that you would need to apply for if you want to participate in that program.
Right. Dr. Patty, I have a question from Ruth. She says that her son is 59 years old, has Down syndrome, had a stroke, has dementia with related behavior and seizures. We have no assistance. I'm 81 years old and my partner is 77. Until now, we've been managing on our own. My son needs a vaccine. He cannot be taken to a site. How can I register my son so he gets a vaccine at home?
So once again, this is, it's a hard situation to be in, and I want to acknowledge that. And so I think the best approach in this situation would be to connect with your primary care provider, your family physician, physician or nurse practitioner, or who provides your son's care, and see if they can connect with Ontario Health Team or with the local health integration network to see if they can someone can come to the home and provide an immunization. Alternatively, if you can connect with the pharmacy, and if you can bring your son to a pharmacy, that's another alternative as well.
Okay. John, the federal government like to weigh in?
Federal government doesn't need to weigh in. The major issue for the federal is securing supply, and that's been the 4-month drama story is just trying to get supply, and seeing expectations. Government had legitimate expectations of more supply by now, but didn't anticipate that say India, for instance, is a humanitarian disaster. And that's affected supply, didn't anticipate. And how could it anticipate that one of the manufacturing facilities in Europe went down? It is what it is. We are where we are, and we have a reasonable expectation that that over the next few weeks and months, we will be, I was going to say flooded, but I think the number is 40 million by the end of June, and that's more than the population of Canada. And so hopefully all of these conversations about whether I got a second dose or I don't have a second dose, or whether I want this one or that one, and et cetera, will be behind us. And if what you're saying is correct this evening, which I think it is, hopefully next week you'll be busier than you are this week.
Dr. Patty, do you think people that have received their AstraZeneca, if we don't have a supply for second doses, would it go, like, for example, Pfizer, would they go back to kind of like their first shot didn't happen and they would have to do 2 doses of Pfizer to reach their 90%? Or is that still something that's being looked at? Or
it's being looked at, and I know there's studies actually actively being that are being undertaken in Europe, exploring that. And actually, not to go too far out in the future, some people may have already heard that Pfizer is actually recommending a 3rd dose for anyone who even got 2 doses of Pfizer. So it's really too early to tell. I think as time goes on and more studies and more research is done, we'll have a better understanding. But who knows? This could be, COVID could be with us for a really long time, and we might have to get our shot like we do every year with the flu. So, as we learn more about this disease and about this virus and the vaccines and how they work, we'll get more details on that.
Okay, perfect, excellent.
So I actually have a provincial question. So I'm going to answer this one,
okay.
Dr. Patty. So you can take a
thank you.
Catch your breath.
Get a glass of water.
Yeah, I'll take a sip of tea.
Order. And there is one really important provincial benefit that I want to remind families and for people to spread the word, and that's the Ontario COVID-19 child benefit applications. They are now open until the deadline is May 17th. And this is currently offering a benefit of $400 for each child of school age. Grade 12, and $500 if that child has a special need. So if you've already registered for this in previous rounds, you don't have to do anything. You'll just automatically receive this benefit. But if you have not, for some reason, registered before, it's important to do so before May 17th so that you and your family can have those really needed and important benefits. So that's in response to John.
Okay.
Thanks, Betsy.
You want? Are we doing wrap up now, or are we not doing wrap up?
Yes, I was just going to say we're going to let our guest of honor have the closing remarks first. Dr. Patty.
Thank you so much, Councillor Ainsley. And And thank you, MPP Hunter and MP McKay. Thank you so much for being here, and to all the constituents in Scarborough. It's I actually quite enjoy doing this and connecting with people. It actually gives me sort of a sense of what people are concerned about, and if I can do anything to ease your mind, that's what I'm here for as well. And I just want to remind people, and actually firstly I just want to say thank you so much for showing interest in immunizations and vaccines, and continue to encourage all your friends and your family members to get vaccinated, because this will help us end the pandemic sooner. And also along those lines, just keep on sticking to those public health measures. I know the weather's getting nice outside, it's barbecue season, but we still need you to stick to your households right now and do all the right things. So maintaining your distance, wearing your masks, staying home if you're sick, and washing your hands a ton. So with that, thank you so much, and I wish you all a good evening.
Thanks, Dr. Patty. Mitzi?
Thank you, and thank you so much. This was a really fun hour, and I learned a lot from you. And don't listen to John about the math. I have an MBA. Keep it all straight in terms of what's coming or going with vaccine supply. It's not very easy to do, but I want to say, I believe that Toronto Public Health is doing a really terrific job on the immunization rollout, even with the bumps in the road and some of the things that have happened. And the work that you and your team and Dr. Davila do each and every day on behalf of keeping us all safe is really important. And I just want to say thank you, and thank you for taking the time to do this evening as well. And to all of the residents that are watching and that do watch, that interact with our offices, know that your input is really important, and the questions that you ask. If we don't know the answer, we often go and seek that answer. I know I do from the various people responsible within the provincial government, and we try to get you the answers to your questions. We are still in this. We're not through it yet. We're still in the third wave, actually. So what's most important is that you and your family stay safe and follow all of the guidelines so that we will get through this together as soon as possible. So thanks for being here tonight.
Thanks, Mitzi. John?
Well, I wanted to thank Dr. Patty for coming here tonight. She clearly has no talent as a politician. She answered all of the questions in a straightforward fashion, full of facts and useful information. So we appreciate your willingness to come and share that information with us. And speaking of a politician giving misinformation, apparently I understated the number of doses that we are to receive. We're supposed to receive 2 million nationally from Pfizer from today on, and 1 million doses of Moderna from May 10th to 16th. So I'm rather hoping that as that supply ramps up, you'll be run right off your feet, Dr. Patty. In the meanwhile, but even during and even after, everybody needs to wash their hands, keep their distance, observe the protocols, and get jabbed.
Thanks, John. Dr. Patty, thank you so much for being with us this evening. I know you've had a year of very long days, and I hope you can enjoy the rest of your evening and catch your breath and get some downtime. It's been a very informative evening. Really appreciate all your expertise and advice. John and Mitzi, as always, it's been a pleasure having another of our monthly town hall meetings, and to all the residents of Scarborough Guildwood for listening. And I will say the same thing as I do every month. Please follow all of the social distancing rules, wash your hands, get jabbed, and we will all get through this together. Thank you so much for everybody, and I hope everybody and your families stay safe and well. Thank you very much.
Thank you. Thanks, Dr.
Everyone. Bye.